It's a vast expanse of land filled with rubbish in the form of coconut shells, plastic waste and other forms of waste. But this dump site has a unique feature which sets it apart from all other ones you'd ever come across. It's the massive presence of electronic waste, burnt daily and sometimes hourly. This is Africa's biggest e-waste dump site, Agbogbloshe, located in Accra, Ghana.
Agbogbloshe, located in Accra, Ghana. It is the biggest and most popular, if you like, e-waste dump site in Africa, as you have it. And every day, tons of electronic material is brought in here to be burnt. As you can see in the background, you can see this is what you have, a residue from, let's say, a TV or a radio. The plastic is melted to give access to the lead and the copper therein, and that's where the money really lies. Agbogbloshe has existed for quite a while right now. I've been told gradually the place came to the birth in the mid-90s, and it's surrounded by a slum. You have a lot of young men here who make a living out of this place, trying to make a living out of it and making their 2 cents. Majorly, the place does serve a socio-economic purpose, and this is the reality.
The process which burns the money involves certain steps to get to the copper. Nan, a worker here in Agbogbloshe, explains the process to me.
So now you're burning it. What's going to come out? What are you doing exactly? Can you just explain that to me?
Yes, when we are burning it, but we have really big seed of copper with robbers. And it burns flesh. It will now come out with the fire with fresh copper.
Oh, so the rubber melts away.
Yes.
Okay.
The rubber will turn to dust.
Okay. Then you can now let it cool off and take off what you want to take.
Yes.
So like
it will just be burning like this, so I now be promoting.
Oh, okay, the copper. Yeah, okay.
The copper is packed into a bag for sale.
Yeah.
Since its existence in the mid-90s, the burning and socio-economic reliance on Agbogbloshe's burnt electronics in search of precious metal has not been without its effects on residents, most especially on the women and children, most of whom reside close by in the old Fadama slum, with a population of about 80,000 residents. Dr. Anita Asamoah is a researcher at Ghana's Energy Commission, who alongside other researchers sampled breast milk of over 100 nursing mothers in the area and discovered cancer-causing metals in their breast milk. In a lecture with fellows of the International Center for Journalists and its Early Childhood Development and Nutrition Study program in Ghana in February 2019, she explains the research outcomes as it affects mothers and children.
Now in Ghana, we have started recording a lot of cancers, childhood cancers and all forms of organ-related diseases. And most of these are as a result of this compound. An aspect is also with pesticide residues that we are also doing, and we know what pesticide residues can also do. So it's a very broad study that we need. You mentioned some parts, so we have started studying the community. As I told you in the beginning of the presentation, I even said we will try to follow up to see the levels in subsequent birth and also monitoring the health of these mothers to see how it goes. But cancer is on the rise in Ghana, which can be linked with our food, pesticide residues, and also some of these activities.
Back at Agbogbloshe, some of the residents, though not active participants in the burning, make a living of spending time around the fumes from the fire. Asmoa, not her real name, like many others, has begun to encounter some health challenges.
Faiza.
What is your name?
Faiza.
How old are you?
Faiza, now 11, has been working here since a very early age to help her aged mother and father make ends meet to pursue her education. The economic situation is a contributing factor to her presence here. I'm told that the chemicals from the burning are also beginning to affect her.
When you get small money, then you used to go back to making wild, to go school.
Okay. Then is she suffering any diseases?
Yeah,
What kind of disease?
this kind of disease way there is getting chemicals for our herbs, for our chest. So now we are praying for more job. When we get job, we will change different job. Or when we get help about this work, you understand, we can follow to help us, then we this can smoke and go top. Then we too we make free for Ghana. Because anytime they are complaining for this smoke. So now we too we are praying for help. What those who can help us, then she can help us, then we'll get more this thing.
Why she is not going for any other job?
There is no other job for her.
What is your name? What is her name?
Yahuda.
Yahuda. How old is she?
Yahuza, 7, going to 8, has parents who do not work, and she is to sell water to the workers at the site to make a living. As the guide says, she too is also getting affected.
He's selling the water, but sometimes when the smoke is turned with inside, it's catching herbs for her chest. Where she's explaining about that one, but she's praying that when you get different job, she can join.
What her father, mother are doing?
In mothers.
Her father, mother, what are they doing?
They are north. They have no son. No son, there is no job. So by here, we have some small jobs to follow about this one. You know, see, we are doing this into selling water.
Which part of North?
This one, we did Tamale. And Tamale villages day. Yeah.
It is done illegally. It's not allowed, but people are doing it. And they are violent, and you talk to them. Even they themselves, they don't care. Once they are making a living, they are okay. They don't care about even how they are exposing they themselves. It's very big. Everyone is doing his or her own thing. And a lot of work have been done there. They are not stopping. That's why I said, then if they are not stopping, we've tried a whole lot, and we are even telling them about the dangers. They are not responding to that. So I think what we can do is to rather train them to protect themselves and also reconstruct the place to a properly engineered e-waste site, and they import everything electronic.
At the moment, the burning and the hustling to make a living by Agbogbloshie's residents and inhabitants continues, while an unfolding health crisis, both waiting to happen and already happening, gradually unfolds. Babatunde Okunla reporting from Agbogbloshie, Accra, Ghana.